The World Health Organization has guidelines when it comes to vaccine testing in humans that explain how human vaccine trials are supposed to be administered, and we have sampled some important ones for you. Let's begin with the WHO stating that it is essential that vaccine trials in human beings only be conducted where informed consent is given and within an ethical framework. Abundant forethought, caution, and oversight should also be undertaken. Now, the value of the information which is to be gained should also clearly justify the risks to human subjects. Moving on, while the vaccine trials are often conducted in animals before tested out on humans, some vaccines are not considered ethical or safe under WHO to be conducted on human beings. Now, this is especially the case if an organism causes a disease with a high case of fatality rate. In this case, it will not be appropriate to consider human trials. And then it's also not deemed acceptable to consider carrying out human challenge trials in children or in any other vulnerable population with diminished capacity to give informed consent. And finally, an important one, the responsibility of human challenge trials also partially falls on countries, as WHO encourages countries to establish an appropriate regulatory and ethical framework for challenge trials. Now, trials-sponsored vaccine developers, researchers, and other involved parties should determine what regulatory expectations the country's national regulatory authority has when clarity does not exist.